Hi, everyone, and hi, Brenda. I'm glad you could join us today. We're waiting on a few more of our TAC members to join, and then we'll get started.
Hello.
Hi, Brenda. I was just saying that we're waiting on a few more TAC members to join, and then we will get started.
Looks like Miranda's joining now.
Hi, Miranda. Can you hear me?
Yep, I'll turn on my camera in just a moment.
Great. Well, I know we don't have a quorum quite yet, but we can get started and revisit the minutes as other members join. I'm Emily Beauregard. I'm the Director of Kentucky Voices for Health and the Chair of the Consumer TAC. And Miranda and Brenda, if you can introduce yourselves.
Hi, I'm Brenda Menino. I represent AARP.
Hi, I'm Miranda Brown, and I am the Outreach Coordinator and a Connector for Kentucky Equal Justice Center.
Great. Well, it's good to see you all here, and thanks everyone for coming today, and especially because we had to reschedule this meeting. We don't have a quorum, like I said, so we'll wait on that, and we can revisit the minutes once we do. We'll start now with old business, and we have a few of those standing data requests related to how many people are currently enrolled in Medicaid.
Sorry, I'm trying to scroll to see who's on, Emily.
Good afternoon. I think this is Veronica Judy Cecil with Medicaid. I think usually the eligibility folks or someone from the eligibility team is usually on to give those numbers. But
We can also hop back to this if we need to.
yeah, let me scramble a little bit, see we can get to you guys. Thank you. I appreciate your understanding.
Yeah, absolutely. And I know Pam Smith can't be with us today because there is a town hall on the SMI waiver, but I think April Lowry is here. And April, do you have numbers related to the 1915C waiting lists?
I do, Emily. Thank you. This is April Lowry from Division of Long-Term Services and Supports, and I can provide our wait list numbers today for these numbers are good through November the 29th. For Michelle P., we had 8,759 on the wait list. For Supports for Community Living, we have 3,357. Out of these, we have 10,728 unduplicated individuals on either the Michelle P. or the SEL wait list. And then also of those 10,728, 4,584, nearly 43% are receiving services on another one of our 1915C waivers while they wait for either their Michelle P. or SEL slots.
That's helpful to know. So is that about 6,000 people then who are on a waiting list and aren't receiving any waiver services?
That's correct. And though, Emily, they may not be receiving a waiver service, some of those 6,000 could also be receiving some other form of state plan services, like children may be receiving like EPSET or, another benefit through the state plan. So that's also important to notice that there's like 5,000 roughly that are potentially receiving another service.
Yeah, that is helpful. Thank you.
You're welcome.
All right. Thanks, Erin, for that update about Melanie. Was she having trouble getting on because of the link or something else?
She just logged in. She was logging in off her phone and was going to, I got her. She just logged in.
Okay, great. And actually,
So
this
that-
reminds me, Brenda had reached out earlier today, and usually before our meetings, at least one TAC member reaches out to me and asks for the link to the meeting. Erin always puts those links in our calendar invites, but if you don't have it for any reason, the information is also on our consumer TAC page. I've linked that TAC page to the top of our agenda because at least in the past, I think Erin has a pretty good handle on this, but in the past it would sometimes change and I didn't know that it had changed. So I just started putting the link to the consumer TAC page. But I realized today that that link has also changed. I think DMS probably went through some sort of reorganization of the website. And so I need to update that link, but just so everyone knows, that was my intention with having the link there so that you could have easy access to the consumer TAC page. But then I realized that it was broken. So I'll be sure to fix that. And welcome, Melanie. Hopefully you can hear us.
Yes.
Great. Thanks for joining.
Emily, that gives you a
Hey,
quorum.
Melanie.
Yes, that's right. Thanks, Erin. Yeah, we have a quorum now, and why don't we go ahead and return to the minutes? Hopefully everyone received them and had a chance, and by minutes, I mean transcript. It is very long. Had a chance to look over it quickly. Let me know if anybody has any questions or anything that they think needs to be changed before I call for a vote to approve them. Well, then I will ask for a motion to approve the minutes from our October meeting.
I motion to approve the minutes from the October TAC meeting.
Can I get a second?
I second.
Thanks, Brenda. And all in favor, say aye.
I,
Any opposed? All right, motion carries. Thank you. What I do with those, since they are so long, if I'm ever looking for something, I just do a keyword search, just as a little tip. Otherwise,
The recordings are also on our YouTube page. If you ever want to listen while you're working, kind of searching those as well.
that's a good reminder. Thanks.
I do that when I have to search my notes sometimes. So
Yeah. So Melanie, we were just going over some of our standing data requests and we got the update on the waiver waiting list. Are there numbers yet, Veronica, for the just Medicaid enrollment generally?
I was just putting something in the chat. Someone should be on very shortly.
Okay,
So
great.
we can let you know when they're on, and at the pleasure of the committee, we can
Okay,
come back to that topic. Thank you.
that's great. Would you be able to answer that third item? How many people received a renewal notice RFI or renewal packet in December, and how many are scheduled to receive one in January?
I don't have that data. I believe the person who'll be coming on.
Got it.
Yeah, thanks.
Okay. Then why don't we jump to the HCBS rate study and PDS rate increase? Any updates to offer there?
Emily, so with the HCB rate study, it is still with the executive team, and we do not have an update to provide, but as soon as we do, we will ensure that we share that information here with the TAC. Hopefully, we will hear something from that sooner versus later. Also, the PDS rate increases. I know that our team, Department Medicaid team, and also Department for Aging Independent Living continue to work with our consumers that are accessing the participant direct services and also assisting agencies with those rate increases. So, a PDS participant and or their PDS rep may ask for the up to the max pay rate increase and work with their agencies. And if there's any concerns or issues, those agencies can also outreach to us or the PDS participant or PDS rep. We are like I said, continuing to work through those and coordinate that between the participants and their agencies.
Okay, that's good to know. Thank you. Any,
Can,
I was just
can
gonna
you,
ask for any questions. Yeah, go ahead,
can you
Brenda.
remind me what HCBS stands for? What is that an acronym for?
It is the Home and Community-Based Services.
Okay, thank
That's
you,
our 1915C waiver umbrella.
thank you.
You're welcome.
Any other questions? All right, why don't we move on to the DMS report on the hospital rate improvement program?
Emily, I believe that would be Angie, and I don't see her on. She may have had a conflict today.
Okay.
I'll put that in the follow-up email.
That would be great, thanks. I also looked back at some of our recommendations from this year, and one of our recommendations was related to just how we track the track the impact of the hospital rate improvement program. And the response from DMS was that they'd like some input from the consumer TAC on how to do that, but we're interested in having a process in place. And the same was true. I think we made a similar recommendation for CHW billing. So that may be something that we want to discuss at our next meeting. The next item here is network adequacy demo and getting input from providers and consumers. We discussed that at the last meeting. Angie would probably be the person for that as well. So, oh, Veronica, what were you gonna
Emily,
say?
I want to give an update, and I apologize. We should have let you know this. There's several meetings going on right now simultaneously with this meeting, including a MCO operations meeting. So a lot of our lead people are on that. That's regularly scheduled during this time. So I think a couple of folks will be joining shortly. I do want to note, I believe Jordan Griffin's on now. She's popped over and could give some of the data updates.
Okay,
If
thanks.
you'd like to swing to her. And then we do expect Angie to join shortly.
Great.
Yes, good afternoon, everybody. So this is in regards to the request for our eligibility numbers. So for presumptive eligibility, right now we have 859 individuals receiving presumptive eligibility Medicaid. For the emergency time limited Medicaid, we have 151 members. In traditional Medicaid, we're showing 142,909 individuals. For managed care, we're showing 1,485,505 individuals. And total enrollment is 1,628,434.
Thanks. That's good information to have. Does anybody have any questions about that?
What was the number under the traditional Medicare?
142,919.
Thank you.
And Jordan, I was just looking yesterday at the Medicaid statistics page. I think a lot of things have moved around recently, and I vaguely remember somebody telling us that there was the website was being kind of revamped. I noticed that the reports, I think the most recent report is September. Do you have an update on when October and November will be available?
If I'm remembering correctly, those reports were coming from our data warehouse. And I think the decision was made to use our eligibility system for that data going forward because it would be more accurate. So I don't have a timeline of when that information will be posted to the website unless somebody else does.
Yeah, Jordan, I'll take that. I think I've kind of explained this in a couple of different forums, but the report that was being posted, as Jordan mentioned, comes from our data warehouse. So our eligibility system, which is separate, sends the information over to a data warehouse and then the report's generated. Depending on the timing of that, the report may not be the most accurate reflection of what has happened for the eligibility and enrollment. And so we have been looking at starting to pull that data from the eligibility system. Anytime you're talking about a change like that, it unfortunately takes a lot of time. I think what we're going to do in the meantime is go ahead and continue the report out of our data warehouse. We'll add October, November to it. But the timing is just going to lag. Normally we have it posted that first week, but I think we're going to lag about a week or so. So more towards around the middle of the month so that the data warehouse can catch up and ensure that the information we're sharing is a little more accurate in terms of especially of the number of terminations
Right.
as a result of that. So we're working on that right now because we certainly know that that's information that a lot of folks are interested in and we want to have it available. So we'll be doing that hopefully in the next week or so.
Okay, that's helpful. Thank you.
Yeah, we
It's
didn't think it was going to take so long for us to
Mhm.
create the report out of the other systems. So.
No, it's good to have that background. So Jordan, the other question that we have here, the other data request is how many people received a renewal notice RFI or renewal packet in December and how many are scheduled to receive one in January?
Jordan, if you're having trouble finding that, I'm trying to pull up that report so that we can report on that.
Yeah, my apologies. I was all over the place today and didn't realize we had the TAC meeting. So I'm trying to scramble to get that for you. So give me
Yeah.
just a couple minutes. I can find that number for you.
We rescheduled it and
Okay.
it ends up being a hard time for folks. So hopefully next year we'll be able to stick to our schedule. Let's see. I had something else I was going to ask. It's slipped my mind. But
I have I might be a little wonky as I walk through this, but can provide I'll try my best to provide some of this information. So for December, the number of folks, let's see, let's take it in order, who've received a renewal notice. We had we sent 5,550 renewal packets. Let's see, what was the next? RFIs. So a request for information for folks that we attempted to passively renew, but were unable to passively renew. We have 8,281. We did, I would say, let you know, so we were able to passively renew 36,590 folks.
that's great.
And then, oh, I'm sorry, I gave you renewal packet. And then total for renewal of individuals is 42,140. That right? Let's see. Yeah.
And that was for December.
December. Yep.
Okay.
Yep.
Do you have terminations?
Yes. So for terminations, we have 1,830.
Okay.
I don't have January numbers yet.
All right. Thank you.
Yeah, we're still in the processing for January.
Okay. One thing that we've seen, and I can't say that we've necessarily seen this recently, but I know that we've had some examples of people who went through passive renewal, but were terminated. And at least from what we know, didn't receive an RFI. Now, that's a hard one to, to
Yeah,
necessarily confirm, but one of the things that we've discussed is that, when people get a notice that says they are eligible for QHP or might be eligible for QHP with premium assistance, and there's information on that, that says if you think you're still eligible for Medicaid, you can do XYZ. But those individuals should be getting an RFI if you determine that they can't be passively renewed. Is that right?
that's correct. Yeah, they
So
should
they
be
shouldn't
getting it.
only receive that notice. That should be the second notice that they would receive. Like it would first be an RFI, and then if they don't respond to that or they're still not eligible, then they would get that notice about QHP.
Yeah, and let me take that back and just verify things. And we're certainly happy to provide a copy of the notice. That individuals that we've gone out and tried to perform ex parte, and the system's coming back and telling us that if we're going out and trying to verify the data source, that will generate an RFI. If somebody has told us, so they've actually reported to us that their income has changed, I think that's handled a little differently. But let me go back and get some clarifications and make sure that we're all on the same page.
Our real concern is just that nobody is being passively terminated without getting an RFI.
Absolutely. I understand that. Yep.
And it seems like, again, we're not in anyone's home, so we can't verify if they've gotten a notice, and it's hard for
Mhm.
y'all to verify that too,
Mhm.
to know that it was delivered and received. But we have heard of instances where the notice that people are aware of is the one saying that they're not eligible, and that, they may be eligible.
Just talks about the QHP or the availability of the QHP. Okay.
Yeah, exactly. So, yeah, if we could just kind of dive into that a little deeper and make sure that that RFI is getting out to folks who you are, suspecting probably aren't eligible, but need to verify.
And Emily, this is Melanie. Can I ask a question? Because would it ever be a possibility of information going to a case manager versus the actual individual with this group of individuals?
It gets sent to the member.
Okay.
The member drives where the notice is sent. So,
Okay.
I know sometimes, members might put a representative, on there, but, we always send it to the member.
Okay.
I would assume that there are times when if somebody authorizes someone else, to receive those messages or notices, and then their case manager changes or is out, it could happen that there's a gap and that someone doesn't get the message, or the notice passed on directly to them. So it's something that we should be paying attention to. And I would say particularly for people who are in long-term care or in a waiver program, they should, make sure that they're updating that from time to time, because it could be that
Absolutely.
something's, changed. So it is something to keep in mind.
Absolutely.
I think we've covered everything there. Does anybody have any other questions or anything to bring up related to the data requests and Medicaid renewals? Okay. Now, Veronica, which of the next items do you think we've got the right people on to address?
Let me check here.
We don't have to go in order.
Okay, I appreciate that. Let's see, let me look to see if Angie has joined. Angie, not to put you on the spot.
I'm ready. I
Um,
know Emily's been asking for this for a while, so I'm ready.
yes, okay, excellent. I shall turn it over to Angie.
So, Aaron or Kelly, I don't know, if you can let me share.
You should be co-host now.
Now. Find the right report. There we go. What I am going to show you is what was part of what was submitted to CMS for the 2022. That's not what I wanted to provide you, but I can show you, this is for 2024, what it was submitted for 2024. I was going to show you what we made for 2022, but while we're here, what the measures are that are being planned for 2024, 30-day all-cause unplanned readmissions, sepsis screening and bundle compliance, CAUTI is catheter assisted UTI associated, and CAUTI low volume, C. diff. I'll let you all. I'm sure I would butcher that. Claustro, yeah. Short name is C. diff. It's a gastrointestinal type issue, typically obtained in the hospital. Social determinants of health, hours of physical restraints for psych only, hours of seclusion use for psych only, patients discharged with multiple antipsychotic medications with appropriate justification, discharge to home and community, just discharge with an opioid RX prescription, opioids for uncomplicated vaginal delivery, suicide screening in the emergency room, maternal depression and SUD screening, and emergency department opioid use for acute ankle sprain. I believe that is it for 2024. Now,
Thank you, Angie. That's good to see those measures. Can you tell us if anything changed from 2022 to 2024?
well, I'm going to try to, yes, there were additional.
You added measures, but didn't take measures away. Is that?
We added, we did, I'm pretty sure we didn't take anything away. I'm going to take, let's see, I can't. I don't know why it's not showing up where I want it to. So I will. I don't want to get up. So I'm going to take myself off video. And if you want to go on to somebody else while I search for this, that's fine.
Okay, we can do that. And I do have it. I wanted to know a little bit more about how you're also kind of tracking things, but what would the next topic be that you all can speak to at DMS?
Hi, Emily. It's Angela Sparrow. Leslie and Pam again is attending the 1915I educational session. So I wanted to provide an update regarding the 1915I and the 1115 SMI waiver that was on the agenda. So again, thank you for everyone who was able to participate in the 1915I sessions that was held last week and this week throughout the state. Again, they do wrap up today. I think again we had fair attendance at the in-person, certainly had good attendance for the virtual sessions that were the in-person that was made virtual as well. So again, I think we received some good questions. Certainly, value everyone's input. Again, we're able to meet with some of the consumers, which was able to provide some valuable feedback as well as to what is currently proposed and drafted under the 1915I. So just a reminder, the presentations and the recordings of those will be posted on the website. Today does conclude that, so hopefully again within the next week. Following these sessions, again, we will review those questions and feedback, continue to complete the draft of the application, and move towards a public comment period, an official public comment period. And so again, we would anticipate that that would be next again into the next year, early next year. So that would be a 30-day public comment period. Notices would go out to everyone when that is posted for an opportunity to view the actual application. So again, the educational sessions was really kind of the overall, as we know, when we look at the official application that's submitted, sometimes those are lengthy in words as far as how to read through those, and it can be complicated. So really it was, those were opportunity to provide a high-level overview as to what to expect in that. So those are the next steps regarding 1915I progress and submission to CMS. Regarding the 1115 waiver that was submitted to CMS in May of this year, we have not received any additional, any additional questions from them. We had some initial questions that were answered, responded to around, mostly around the recuperative care pilot. With that being said, the National Institute again did recently release a playbook around medical respite. So our team is viewing that playbook, that guidance, to see again how our proposed service aligns with that criteria and guidelines, to see again what we could incorporate or if we should make any proposed changes. And so that's something that we're reviewing as well. We do continue to keep all of the amendments on our monthly calls with CMS. So we have a call with them next week. Plan to reach back out to them during that time and ask if they have any additional questions for us regarding that proposed amendment, or again, if there's anything that the state needs to do. But we do really anticipate with the submission of our upcoming reentry waiver, that really a lot of the negotiations and questions will kind of align with the same time, and hopefully approval for all of those amendments at once.
Thanks. That's a good update. I wanted to go back quickly to just the town halls that are happening now and have been for the past couple of weeks. I've talked to about 3 people, at least 3 people, maybe more, who have attended either in person or virtually. But for those who attended in person, I think they were surprised and disappointed, to be honest, that there was no opportunity for like two-way sort of dialogue, that there wasn't any opportunity to interact and, ask a question or share input, just kind of vocally during the meeting. And that it seemed very just, like this one way, presentation, like you just described it as education. And I think that's probably what it was, an educational session more than a town hall. So I think maybe expectations were different for the people participating, and to, drive and attend something in person in the middle of the day, you are going in person typically because, you want to have that opportunity for engagement more so than, kind of zooming in into a virtual meeting. So I've noticed that that's been true of some other, public meetings that have been held on recent waivers as well. And I understand why you don't want to prematurely answer a question or provide information if, something is still sort of in process and under development. But at the same time, there has to be a way that people can at least feel like their questions are maybe being heard, and that some, there could be some that are easy to answer and others that aren't. And then just taking that opportunity to take general feedback as well, and not just in writing.
Yeah.
I think people would appreciate it and feel like they're getting something more out of the process. And I mean, I hope that this is
Emily.
constructive feedback. I understand that those are always meetings, like I said, you're trying not to overpromise or, you know, say something that ends up changing. So I do understand that aspect of it.
Hey, Emily, it's Pam. I think that we are going to, so we've collected all of those questions and the ones that have been submitted. I've gotten some to my personal email as well as to, we've gotten them in the public comment box since the meeting. So we're gathering all of those. And then before we put the waiver out officially for public comment, I think that we will do like one more probably virtual session or maybe even after it's been out for a week or so, or maybe in the middle of it while people have had time to look at it, to give stakeholders additional opportunities to ask questions and to provide that feedback. And I know I've talked to a couple individuals at some of the sessions and have staff that are going to work with them. I have their names so that they can we're going to reach out to them and call them and help them to collect their feedback so that they don't have to go through, you know, type that up all again. And we'll offer that. That'll be one of the mechanisms like we do usually for the public comment as well. So trying to give everybody every opportunity possible. But yeah, we are taking that feedback back. I have heard that, and so we are listening to that. So
Thank you. I
Emily,
appreciate
this
it.
is Leslie. I was just going to let you know too that any folks that were here that had personal situations, we've met with them after the session. So we've had our Richmond and our Louisville, both of those had personal meetings with you know, moms and dads and things like that, caregivers.
Okay, that's good to know. And I'll just say, you know, part of it is you know, as much as you can, providing that opportunity for some interaction. But when you expect it to just be informational, I think just make it very clear that it will just be informational, so that people don't come with the expectation that it will be more of a town hall style where they can speak up or ask a question, whatever the case may be. So I think can be a mix of ways that you kind of address that moving forward, but I appreciate what you all shared in terms of how you're making adjustments. So thank you for that. Do people have any questions about the waiver? All right, why don't we go back to the hospital rate improvement program measures?
Make sure I can get it correct this time. I think I can. Okay. So for 2022, the quality measures, as I mentioned, the catheter assisted UTI is the same for 2024. And here are we have the benchmark, the goal, total number of hospitals meeting the goal, and total number of hospitals not meeting that goal. So for that in 2022, 20 met, 10 did not. For the utilization ratio, for the catheter utilization ratio, all eligible hospitals met. For the C. diff, 34 hospitals met, 12 hospitals did not. And the rate, all eligible hospitals met the goal. Sepsis screening and bundle compliance, all eligible hospitals met. Readmissions within 30 days, 78 hospitals met the 5% improvement and 76 met the 10% improvement. 21 hospitals did not meet the 5% improvement, and 23 hospitals did not meet the 10% improvement. Concurrent e-prescribing, 95 hospitals met the goal, 7 did not. Provider opioid education, 90 met, 12 did not. SDOH screening, 97 met, 10 did not. But you know, this kind of gives a little information on what each measure is about. Hours of seclusion, all eligible met. Hours of restraint, all eligible met. Admission screening for violence, all eligible met. Discharge the community, all eligible met the goal. And that is it for 2022.
So a lot of those 2022 measures were establishing that benchmark to compare to 2024. Okay. Which makes sense. Can you remind us, I know that when the hospitals agreed to make improvements in order to get this enhanced payment, what is over time, what do hospitals have to maintain, or what level of improvement do they need to demonstrate in order to keep the enhanced payment?
It's 5 to 10%, I believe, Emily. I will have to get the specifics for you on how all that was paid out. Excuse me, I'm very hoarse today. I'm not sure why.
And is it that as long as so many hospitals are meeting these measures, meeting the benchmarks, that all hospitals will continue to be paid that enhanced rate, or will hospitals be paid different rates depending on their performance?
Depending
will
on their
some potentially lose the enhanced rate?
It depends on performance.
Okay, but it wouldn't be all hospitals.
No.
Okay. All right, well, that's good to know. Is 2024 the year in which CMS would make that decision after we've got the benchmark data now, and then we have another?
We submit a preprint every year. We have to do that. It's an annual requirement of CMS. So we have to get what you just saw for 2024 is what we're getting ready or just submitted to CMS for their review and approval. So it can change every year if we wanted to, depending on, what the measures are. They just have to, even if we're setting up the benchmark, they can approve that. They will approve that as well. If we don't have something, they do give us time to determine a benchmark.
Right. That makes sense. And once you have the benchmark, though, after another year or two of measurement, is that when CMS or DMS would determine if a hospital is still eligible for that enhanced payment?
Yes, we can, like I said, we can change it every year, each measure if we wanted to, but it doesn't make sense to do that. It takes usually.
Oh, no, I'm sorry. I'm not being clear, I guess. I don't mean changing the measures. I just mean determining performance and whether or not a hospital can still participate in the HRIP program.
If I
based
think
on performance.
they can, all hospitals can participate that are eligible. If that makes any sense, but anyway, every year that are part of the hospital rate improvement program. If they do not meet the measure, then they don't get paid. So that's more of.
So it's even on a measure by measure basis.
Yes.
They'll all still continue to participate in the program, but if they're not meeting that metric, then they're not getting paid the average commercial rate for those particular services.
Yeah, so that's,
I see.
And this is beyond the math part, and the actuarial part of all this is above my head. So
but it's not that they just are no longer getting the average commercial rate with Medicaid members, generally speaking. Okay.
Yes.
I see.
I hope I said that right. If not, I will let you know the next meeting.
I was mostly just wondering how exactly CMS was tracking this and determining, whether or not to continue the enhanced rate, based on performance.
No, they allow us to track it, and basically what they're doing is approving how, when we submit our preprint or what we're planning on doing, they either approve that or not.
Okay.
And if there's certain areas in which they disagree with or think we need to change, then that will happen.
That's
They
good to know.
usually send, if it's not clear to them, they will typically submit questions back to us, and then we answer those and make adjustments as necessary to the preprint.
Okay, thanks. Does anybody have questions or thoughts? Angie, one thing that we had made a recommendation earlier this year that there be a process to track, performance and the impact more than anything of the HRIP program. And the response from DMS was that it was a good idea and they would want some input from the consumer TAC. Now, I think it would be helpful to know a little bit more about what kind of input would be useful and what kind of tracking process may already be in place. But I think we would be interested in, being able to have a little bit more input, one, in what some of those measures are, but then, and what a potential report might look like, how the information is used to, continue to make improvements.
KHA, we work with Kentucky Hospital Association. They're basically the head of help facilitate all of this with all the hospitals. And I do have a draft of, some of what's been accomplished for the 2022 that was submitted to CMS that I could provide to you all as well. That
Okay.
included what I just went over.
Yeah, that would be helpful. And then I think when you put the preprint together, that would probably be the best opportunity for input. Am I right?
Probably, but it's based on, we work, like I said, work with KJ. What are some of the areas in which we know needs improvement based on either claims or what is being seen, obviously, at any time during the year, because this is typically submitted at the end of the year for the following year. Obviously, if there's anything in feedback at any time, you feel free and you can reach out to me. They're on that you may see that you think we should be following.
Okay. I think it would be helpful to have, a draft of the preprint in order to provide that feedback. So perhaps next year, before you submit, if we could review a draft, we could give you a little bit more.
And Aaron can get you a copy of that.
Okay, that would be great. Thank you. I know we got one
She is our submitter of our preprints.
Got it.
Yeah, just to add to that, I think maybe let us think through a really good process for that. We are one of our focused areas, and I would actually say priorities as we move into 2024 and beyond. Now that we have a good sense that we're going to be here, hopefully for 4 years, to really start doing some other things and put some things in place. Quality is going to be a primary focus. So we're right now talking, just trying to sort of get our ducks in a row to try to figure out, well, what's that going to look like, and how are we going to? We want to bring stakeholders to the table. We want a good, diverse group of individuals helping us, make the decisions about where we go and how do we measure it and evaluate it. So I think maybe what I would foresee us, and this is subject to change as the commissioner gets involved, but moving forward is that, a couple of months prior to when we really, working backwards, a couple of months prior to when we would submit that, is to talk with you all about, where our priorities. We really want to align quality metrics across the program for all the different value-based programs, what the MCOs are doing, what individual provider associations are doing or are focused on, and really just kind of trying to align efforts so that we're working together towards certain outcomes. So I think maybe, we'll keep this as a conversation about what does that look like, and how can we maybe present to you all for a conversation, for discussion, as a TAC agenda item to to be able to provide that thoughtful feedback. Because I do think, yeah, it's good for you all to know what we're thinking. It doesn't mean it's in stone. We really are looking for that feedback, and we do want stakeholders helping us develop what that quality program is going to look like as we move forward.
Well, and I'm all for alignment across these different value-based reimbursement models. So yes, that sounds like
Yeah, I actually am working on, what we have with the value-based purchasing program with the MCOs, the HRIP program, and what we're doing with UKU of L, working on a document to kind of show what all of those are and comparing those. And as Deputy Commissioner Cecil stated, we've got all the MCOs doing value-based contracts with providers, and what do they look like? And just from yesterday, Emily, the SHIP meeting that we had, the State Health Improvement Program, that all ties into.
that was on my mind. Yes.
Yeah. So, I mean, that's what I was thinking, because that was the first meeting I was able to attend. The first one I had at a conflict. So, and just reading through all that, there's so many good meetings or whatever's going on, and how they all intersect with what we're doing and what the cabinet's doing.
Exactly. Yeah, no, that sounds good. Is it maybe summer of 2024 that you would anticipate starting to work on the next preprint, or getting people together?
Well, I mean, the preprint is one thing. The overall quality and how is another. Well, they tie into each other. But obviously, any ideas, I mean, we can share what a general preprint looks like, or what the latest one was of, that until we get CMS approval, we're not going to share a preprint. We get a approval, then we can share the 2022 preprint, so you can see what it looks like. But if your question is overall quality, what?
Yeah, both. I mean, yeah, it does. I'm interested in more than just the preprint. I was just trying to think timeline wise, and when we put it on the agenda, what would make sense.
Midsummer will give me
I think a summer meeting is it would be right for us having a conversation about what we're going to look for in the next preprint, because we'll have it submitted by October. No, when do we usually submit those, Angie?
Yeah, we try to get it in October, November at the latest, and then because we have to give them time to come back with questions and answer those.
So even early summer. I was going to try to. I know the meeting dates are on they're on the agenda. There we go. So maybe that June 18th meeting would be a good meeting for this to be on the agenda. My recommendation.
That sounds good. Thanks. Any other discussion about that before we move on? I think we've got another item for you, Angie, which is the network adequacy demo. Just follow up really from what you presented at the last meeting, and what we discussed about potentially getting some input from providers and consumers about how to better track or how to better measure network adequacy, and particularly when we have gaps in adequacy, and when the unmet need, essentially, when people are looking for a service or a provider and can't get it, that's hard to capture. And we'd love to just kind of brainstorm ways that we can do that.
Sorry, when I saw this on the agenda, I was thinking maybe this was comments that you all as a TAC may have. Obviously we are, as I alluded to previously, that we are looking at, the EMS is looking at network adequacy and how to effectively address those challenges. And I know with the SHIP meeting from yesterday, that was, that's a huge topic, and that's one of the SMARTY goals. So I think that will be very helpful.
Okay.
I didn't know if there was anything else you had in mind for.
Something I had suggested, and it sounded like there was some interest in it on the last call. the name of the person who presented from your Office of Data Analytics, I'm blanking
Angela
on.
Taylor. Mhm.
Thank you, Angela. And the other Angela. So she had seemed interested in getting some input from providers and consumers. I think we need a process in order to do that. So if there's a way, and maybe you're right, maybe it can happen through the SHIP initially, but if there's a way for providers and consumers to really think through how we capture that unmet need, and just better track network adequacy, generally speaking, I think that would be helpful. And hopefully will inform your work and make it better, because I really liked the maps that you had been working on. I see that where the gaps are too.
Yes. And the conversation that were had at the Kentucky Voices for Health meeting you all had a couple of weeks ago, knowing, asking the boards to get that information would be very helpful.
Yeah, the
And
licensure boards,
it's-
absolutely. Yes.
Yeah, so
I mean,
there, it's multiple tentacles on how to address it, but we are working internally within certain divisions within Medicaid to see if a provider is enrolled, are they actually seeing Medicaid patients? And if they aren't, how are we going to address that and find out why, and utilize MCOs to ensure that what they're actually reporting is actually being, providers are actually seeing patients. So it's a process, and provider and consumer, obviously at any time we do welcome input.
well,
But I do think with the SHIP and other avenues that we're looking at this holistically, will be of great assistance.
and maybe we can get Angela looped into that work too. We haven't voted on those goals, but if network adequacy is one of them, then I think that would be something that we'd like to work with you on more closely on.
Absolutely. Sure.
And you're right, that licensure data would be so helpful. And I thought that the 2023 workforce report outlined it really, really well. So thank you all for that. Anything else related to network adequacy? And Arthur, I saw your comments in the chat, and happy to wait until we get to the recommendation section, but if you want to discuss them sooner, we can do that as well. We have, on the next item on the agenda is language access, and we had discussed a few things. One was a potential recommendation, which we tabled because you wanted to have some further discussion. And then we also discussed, how DMS could put together a language access decision tree so that people better understood, how that process works, where they should go first to, request an interpreter or translation, and what to do if, for whatever reason, they aren't getting the services that they need. So there are kind of two items there, but would you like to go ahead and address what you put in the chat, or wait?
If you want to, you can. You say if you want to, you can read that he wrote.
Okay.
Out of it.
I'll read it. Okay, thanks, Arthur. So it says, when we get to the recommendations, I want this to be posted and read every word. First of all, I want to apologize to Protection and Advocacy, whom I represent on the TAC. Also apologize to the TAC committee for not getting what I was trying to write finished before today's meeting. I want what I have written so far at this meeting, and I will finish what I'm trying to write out by the meeting in February. In October, at the Consumer Rights and Client Need TAC meeting, the chairperson, that's me, made a proposal that the Consumer Rights and Client Need TAC Committee make a recommendation to the MAC that the MAC asked or recommend to the Department of Medicaid Services to pay for translators and interpreters when foreign nationals, refugees, and people who speak different languages and dialects other than English, when these people go into the hospital or visit the doctor's office. And Arthur is asking that the chairperson table this important recommendation until today's meeting, Because in the current form, it would have left out a large segment of the Medicaid consumers, which is people from moderate to severe speech impairments. No doubt there are untold thousands of Kentuckians in the Commonwealth like myself who has from moderate to severe speech impairments who are Medicaid recipients. Before 2019, persons who had severe physical speech impairments and who were Medicaid recipients could not bring their personal aides and attendants to hospitals and doctors' offices to translate or interpret the words of the person with speech impairments to the medical staff and charge Medicaid for this service. These aides and attendants rendered to the individual with severe speech impairments. If the Medicaid client tried to bill the Department of Medicaid Services for this cost, the Medicaid recipient could be charged with Medicaid fraud. Then in 2019, the COVID-19 coronavirus pandemic broke out and threatened to overwhelm all of the nation's hospitals and the entire medical system. So is that when it changed, Arthur? And people are now allowed to have their attendants translate and interpret for them?
DMS. DMS has put out several several members. And some of them state says what oh, and some of them says one thing and other people and other memos says something else. He is going. He is going to write. He's going to write about that. But yes and no.
It sounds like it's inconsistent still, whether or not people can bring an assistant or attendant to interpret or translate for them, and also whether or not they will get paid.
Penn Smith. He said he wants Penn Smith to be
Okay.
at the next meeting. And he will ask her what's going on. He said, thank you.
Yeah, thank you, Arthur. And we can put that on the agenda for the February meeting, absolutely. And certainly
Emily,
don't want to leave out anyone with language needs, whether it's language impairment or speaking a different language and needing a spoken, interpreter. But it sounds like Melanie has a question or a comment to you.
And I want to, Arthur is my hero, and so thank you so much, Arthur, for putting that information out. I just would like to also include individuals that just so happen to be nonverbal and use other kinds of like communication devices and whatnot. So, but what Arthur has shared is really important, and I really appreciate him sharing that information. So thank you.
Yes.
He's gonna write about what she said.
Okay. Well, this is a thought that I'm having right now. I know that Miranda brought up the language access issues that we were discussing at the October meeting. I think we've got, people who speak different languages. We have speech impairment and we have people who are nonverbal. So it may be that Miranda creates one recommendation for, interpreters and translation for other languages, that Arthur, you do something for people with speech impairment, and that Melanie, you write one for people who are nonverbal. And we can discuss those and vote on those recommendations at the February TAC meeting. Does that sound like a good plan?
Yeah. No. Yes and no. Please. Yeah. We. Yeah.
Not yet.
We should have one. Oh, we should have one recombination. Combination.
Two recommendations.
Yeah. But
There, a number of recommendations, I think I would leave up to y'all. Just to make sure that our recommendations address all three of those populations.
He said he will write about what he thinks.
Okay.
And you can decide which one.
Well, we'll discuss them and decide as a committee, Arthur. But yes, I would appreciate seeing those in February, and the same, Melanie, any thoughts you have on recommendations, certainly can be as many as you think we need, and Miranda, you as well. So we'll plan on that. As far as the language access decision tree goes, that was something that DMS thought they could take a crack at putting together for us. Have you all had a chance to do that yet, or should we also plan on discussing that in February?
We've been working with the MCOs to get to see what they currently do, and we do not have that prepared yet, but yes, we're working on it.
All right, thanks for the update, and we'll put that on the February agenda. We've already talked about the SMI waiver. The next item here is consumer protection from scam calls and short-term limited duration junk plans. We've discussed this a bit at some of our other meetings, and I know that the state is aware of a lot of this activity. Just wondering if there's any update on what the state is doing to limit this and to assist anyone who's been caught in a scam.
Hi, hello, it's David Very. We have sent out to all the connectors and agents, I think twice now, a kind of forward-facing what to look for a QHP if it's not being sold through Connect, if it's not one of these four issuers, if they're asking anything about your health, that kind of thing, to help consumers sort through that as well. We're in close contact with the DOI. We've had one case since Medicaid unwinding started of someone who was sold into the wrong plan, and we handled them by special enrollment. So we remain ready. We're in the middle of open enrollment, so we're not seeing a lot of this. But I think after open enrollment closes, that's when the predators tend to come out. But we've always, in the history of the exchange, we've always recognized this as an exceptional special enrollment reason.
Yeah,
So
which is great. So as long as people are aware that they have an option, And so it's, something that we need to do more education about, I'm sure. David, is the one case that you just mentioned the one that Priscilla may have reported to you?
I think so. Yeah, it was a health sharing thing, I believe.
Well, it was a plan that was underwritten by United Healthcare. And so she thought she was, not Priscilla, but the person who was purchasing this plan, and she was working with an agent or someone who called themselves an agent. But she thought that she was getting a UHC plan, and it was really, another company that was, I don't know. I don't know what the relationship was exactly. But it was, some other like life something doing business under UHC, if that makes sense.
Yeah, they were life insurance, not health insurance. And they were
No,
selling
it
some kind of a product.
In any case, I think that was we typically say if it's these issuers, you should be good. But in this case, it was one of those where the issuer was familiar and seemed legit, and yet the plan was really operated very differently. So in any case, that was one that came to our attention recently.
Mhm.
And the fact that this person who was selling the plan also said that they were an agent was another concern.
Yeah, and they weren't an agent with us. Unfortunately, that term agent can be kind of
Right.
blurry. It's a scary
Right.
word out there. It still remains, we are more than ready to help. We will probably send out another social media an alert like we did, I think we did it a couple months ago about this, how to look for a scam, and that sort of thing. And it definitely opened to any other ideas on how to get the word out. Luckily, it seems to be not that big of a problem. Of course, it is a big problem if it's happening to you. Whatever recommendations there are to further the cause would be welcome.
It looks like Miranda just
Oh,
popped something into the chat.
from United again, right? Yeah, if you can send that to me, Miranda, in an email, and start looking at that. And I always get scared when we see one or two or something that maybe it could be an isolated event, but it could be the tip of an iceberg.
Yeah, when we hear of something more than once, we start to
Yeah,
think,
then you start,
yeah, there are probably a lot of people out there who have enrolled in something and they're not aware that there's a problem. But then they go to use their coverage and
Yeah.
perhaps it, doesn't work for them for many reasons. Or they're paying more than they should, or
They're
they're
paying
really
more, yeah,
for
that's the,
Medicaid, but instead they're paying for something that they can't afford. So yeah, thank you. If you could look into that, that would be great.
we'll look into that, and then we will definitely make a social media post about the same alert that we did last time. We just do it again at a different time, as open enrollment closes, to help reinforce that. Look carefully what you purchased. I hate that we have to purchase health insurance, but be careful that you're in the right plan. And if, like I said, we had several hundred last year, they were all grouped together in this horrible situation in Florida or something. And we were actually able to get those names to the contact center, so they were ready to catch them when they called. So hopefully we won't have anything like that. But with this United Health thing, now that there's two, meeting with DUI tomorrow, we'll have to see if there's something else going on out there that's kind of
Okay.
concerning.
Yeah, thank you for looking into it. And Miranda, do you have anything else that has been an issue related to scams and junk plans?
No, that's literally the only thing I've encountered, and I just encountered it yesterday.
Well, that's good to know.
Okay, well, that's is good, but again, when two look similar, my spidey senses go off and I start to get concerned.
Right.
So
And we
look
know
forward
there are
to
some
following up.
people, we know there are some people who are choosing these plans knowing the limitations of them, but a lot of people, just assume that they're getting something that
Yeah,
is.
there are some limited situations where that might be the best choice, that you're willing to kind of take that, to be honest, gamble, but you're making that choice. But I'm not a fan,
Yeah.
because it can go the other way. So look forward to hearing from you, Miranda, and I'll come back in February and hopefully report that it was only 2. But we'll see what we can do.
Okay,
Appreciate it.
thanks, David.
Yeah.
Oh yeah, Arthur, did you have something?
He said, may he ask a question, personal question? He want to know, he say he's on SSI and he's wondering if he's supposed to be getting a letter that saying he's supposed to renew his Medicaid.
I don't know if Jordan is still on. But the way that works, Arthur, is that someone who receives Social Security, if they no longer are eligible for Social Security, we'll get a file from the Social Security Administration to tell us they're no longer eligible. So generally, they are not subject to the annual renewal that most folks are. So we get notified of a change in your circumstance, in the circumstance of the Social Security individual. And that is what prompts us to then send something out to confirm, or maybe even be able to determine if they're eligible for another type of assistance under Medicaid.
He said, thank you.
You're welcome.
Yeah. He said he been watching the mail. You haven't got, he hasn't got anything. He said, thank you.
Oh, you're so welcome. It can be confusing because there are folks that don't have to go through renewal, and those are the ones that we call categorically eligible. So if you're on Social Security, you could be eligible. If you're a foster child, you could be eligible through a category. So it can be confusing. So I appreciate the opportunity to actually talk about it. So thank you.
You know, Arthur, one of the things that, I'm sorry, did you have something else to say, Arthur?
You just want to say thank you.
One of the things that we've heard is that because, the pandemic stopped a lot of things, including some work at the Social Security Administration in keeping up to date with people's status. And so around the time Medicaid renewal started, a number of individuals were no longer eligible for SSI or had to do something to prove their eligibility, and that coincided with renewals. So if you hear from people, in your community, people that who maybe have gotten that kind of notice from SSI, that's something to pay attention to as well.
Last week. He heard you. You had to? Last week he had to do an interview with SSI. That's it.
Okay, that's good to know. Well, thank you for bringing up that question, Arthur, because we've heard it from folks too. Anything else related to that before we move on? Miranda? No, okay. The next item here is the MAC and TAC orientation packet that I know you all have been working on.
Yeah, we're really close. I've finally had a chance to review it. Right now, we're pretty much just making it pretty, putting on page numbers. And I did have a question though. We were very much focused on letting folks know about the department and who's at the department, and then roles and responsibilities for the TAC and MAC meetings, and how meetings are to be conducted. But I don't want to make it too long, but I had also added in some slides that just talk about the Medicaid program in general, who's covered, what services are covered, and just want to make sure I didn't go too far off what you all were thinking that would be helpful to folks. So I wanted to make sure it's in there now, but if you all think that's too much, we can take it out. So just wanted some feedback on that.
I think that particularly when you're looking for consumer input or input from anyone who's not a Medicaid provider, basically, you
Yeah.
know, in which we have a number of those individuals serving on different MACs and or
Yeah.
different TACs and on the MAC, that background information on Medicaid is really helpful. It's a complicated program. There's so many eligibility categories.
Yes.
I don't think we can assume that people understand it all.
Right. But I added, about the waivers, the different waivers, and fee for service and managed care, kind of what the difference between those are. So again, just sort of, I added in a lot of information just to kind of help understand the Medicaid program in general. So if you guys are good with that, we will clean it up and I think probably be able to have it out. I'll try before the holiday. But if not, then certainly when we first come back in January, we'll be able to release it.
That's great. If we can review it before our February meeting, then we'll be able to give you some feedback then.
That'd be great.
Thank you all for your work on that.
Thanks.
Um,
Kelly and Aaron have done an amazing job. So they did the heavy lift.
That was all Kelly, Veronica. I can
Okay.
I looked at it. That's all I did.
Thank you, Aaron, for.
Well, we'll have to have Kelly on in February to say thank you. And I just, before we move on, did anybody have any other thoughts about what information should be in that orientation packet?
I'm here, Emily, and no thanks is needed.
Okay, well, we'll get to you and certainly happy to receive some constructive feedback on if there's anything we need to tweak, we're happy to do it.
Thanks.
Great idea. Thank you.
Yeah, so we're ready, I think, to move on to new business. We have 2 items, and Arthur, you had asked us to put this proposal to overhaul the Michelle P. and other waivers on the agenda, and you had, I think, someone else that you were planning on inviting to speak. Is that person here with us today? Looks like Arthur's. It looks like Arthur's not in front of his computer right now, so maybe we'll come back to that. The other item that we had under new business was the housing meetings that have been taking place between the Kentucky Housing Corporation and the Cabinet for Health and Family Services. Angie, are you the point person for that? Did Angie have to jump too?
Hi, Emily. It's Angela Sparrow again. I'm not sure again if this is the specific meeting that you're referencing, but I can provide some information that I am aware of, and then again, certainly we'll take it back. Again, their Kentucky Housing Corporation has asked to have a partnership again with the cabinet regarding some of the housing initiatives. Really, again, I think that it has extended from the housing collaborative that has been occurring 2 or 3 years now. Again, it started with a Medicaid Learning, a collaborative. It was around SUD, substance use disorders, and housing that the department applied for and participated in with 10 other states. However, again, in that collaborative, including Kentucky Housing, the Department for Behavioral Health, Medicaid, and again, some other state agencies, as a part of our Kentucky representative. We really, again, kept in mind more than just SUD as far as the Kentucky goes, again, in that collaborative and through that lens, though, again, it was specific to SUD. Once that collaborative ended, again, we continued to meet to discuss the housing needs and continue the work of that. Again, that was when we were also considering the housing supports under the 1115 demonstration. So again, the work continued through that. And then again, as we moved some of those housing supports under the 1915I. So that again, collaborative and work group has been going on for quite some time. But again, they are wanting to meet and do meet at the cabinet level as well. But we can take it back and get some more specific information. I don't think that meeting has occurred in the last few months, again, with several initiatives going on. But we'll take it back. Is there any specific questions around that, or?
Thanks for the background there. Melanie actually brought this topic to, or asked to put this topic on the agenda. So Melanie, if you have anything else that you want to add.
Oh, and thank you. And thank you very much for speaking with us today. And thank you, Emily, for putting it on the agenda. The one thing that I've been learning at the national or federal level is there's beginning to be more conversations between populations that represent intellectual and developmental disabilities and looking at housing needs. And because we've got a huge population of adults with aging caregivers that are going to need that kind of support in the future. And so I think there's been some creative dialogue between HUD and Medicaid and other groups at the federal level, but I just wanted to find out what was happening in our state. And I'm excited that there's been discussion regarding SUD, and that's an important population. But if you also incorporate individuals that are vulnerable, that have intellectual developmental disabilities and limited language supports, I hope that category, that population is also being considered in these conversations.
Absolutely. And thank you for sharing that. So again, that I think the collaborative at the national level had started off, Melanie, with the focus of SUD, but it was very important and evident. Our Kentucky specific focus wanted to, again, to look at housing supports and more than just our SUD population, but across the whole. And so from the cabinet level, again, meeting with that work group in Kentucky Housing Corporation, does include our Department for Aging and Independent Living, as well as Department for Behavioral Health and Intellectual Disabilities, and then Medicaid as well. So absolutely. And so I think, again, Kentucky Housing Corporation is wanting to work with the cabinet to look at opportunities as they have received additional funding, more so than they have in the past, how we can work together between the services and their services to meet more of those needs and address those. And so again, I think that it is an ongoing initiative, and very pleased that, again, I can say it has been 2 or 3 years that we have it's kind of established and developed and continuing to grow. So
Are those meetings public, or can we access a transcript or recording in terms of what is being discussed? Because I know that there's many consumers, myself included, that would really be very interested in being able to listen in or hear what's being discussed.
Absolutely. Again, we're happy to take that back, and discuss, how we can do that.
Thank you. I appreciate the consideration.
Yeah, and Melanie, thank you for bringing this to our attention. I've been, I guess, aware that CMS has been really focusing more on health-related social needs. That's the term they're using, health-related social needs. So that can, kind of encompass food, housing, transportation, those sorts of basic needs that people have that impact their health. And I know that there's an opportunity for states to use some administrative funds, I think that's right, to pay for some of those types of services or resources. And I'm just wondering if that's being considered as part of these, discussions with KHC or just generally at the cabinet, like how do we take advantage of this opportunity that CMS has given us to use some of our funding to address health-related social needs?
Again, not to speak for Angie Parker, or if she's still on the call, but I think again, yes, that's something that we continue to look at, Emily. There are options to expand to address some of those health-related social needs under the Section 1115 demonstration opportunities. Again, incorporating some of those into the 1915 SPAL State Plan Amendment. And then also what in lieu of service through the managed care organizations. So again, I think California has kind of been the lead in incorporating in lieu of services to meet many of those community supports or health related social needs. And so I think that that's something that we will continue to look at. And I think again, not to speak for Angie Parker, but I think again is a priority in the Medicaid strategic plan moving forward as well.
Okay, well, maybe we'll, just add this to the next agenda as well to continue the conversation. I've heard that Pennsylvania has a pretty good waiver or it may still be in the proposal phase, I'm not sure, but something we may want to look at and how they're trying to address those health-related social needs. So we can just continue this conversation because I think there's a lot of interest here and of course a lot of need.
Well, Angela did a very good job, but we do have a specific branch, Equity and Social Determinants of branch within Quality and Population Health, where this is a focus for us in a lot of different ways, just like the language access issue, the transportation issue, and looking more in depth of the health equity lens of the quality of care that people are getting. So this is a priority and part of what our whole division is about. If there's more specific you want, we can certainly get that. And a lot of this, we do have the disparity TAC that we discuss a lot of this information as well.
Good to know. Thank you. Arthur, we are on new business and you had asked for this item to be added to the agenda, the proposal to overhaul the Michelle P and other waivers, but you had also had someone that you were planning on inviting to speak.
Next time.
Okay.
One. That is one of the things.
Okay. That's probably better too, because Pam Smith hopefully will be able to join us and be part of that conversation.
He said that's what he was gonna say.
Okay, perfect. All right. Well, thank you, Angela. We are at the next item on the agenda, general discussion. We don't have anything, outlined here right now. Does anybody have anything else to raise?
He said he does.
Okay.
Yeah. Send out of his gift. He says send all of his gift to his address. Did you guys hear what I said?
Send something to his address. Gifts?
He said you can send all his gift to his address.
All right, all right. Thanks for bringing some festivity to the call, Arthur. Reminding us that we're just 10 days out from Christmas. Hard to believe, isn't it? I think we can probably move on to recommendations. There you go. Miranda sent you a virtual gift.
Hey, Emily.
Huh?
This is Stuart on with WellCare. I would like to mention, I don't know if you all realize, all the MCOs earlier in December, and our association had a free dental clinic day in Mayfield, Kentucky. People started lining up at 7 a.m. I think it was over 230 people got free dental care that day. We all partnered together. It was an awesome event. I was not there, but I've talked to other staff who were, and it was just incredible. I think it was like 7 a.m. to 7 p.m. or something. It was just a really cool thing and really well received.
Great. Thanks for sharing that. Definitely a need for more dental care, so we appreciate it. And I've heard that a lot of the MCOs, maybe all of the MCOs, have also been doing some immunization clinics. So maybe that's something we can learn a little bit more about on another agenda.
Can I ask one more question?
Hmm?
Arthur, are you sending gifts out to everybody else too, or are you just taking gifts?
He's only taking.
Smart, Arthur. Very smart.
Remember, he is. Remember, he's on SSI.
Dude. Ho, ho, ho. Merry Christmas.
Anything else people want to discuss before we move on to recommendations? I have a feeling most of our recommendations are going to come in February. We've already talked about a number. I had one in mind, but does anybody else have anything? Okay. I'm going to go ahead and just to follow up on something that we discussed earlier in the call related to ex parte renewals. My recommendation would just be for DMS to ensure that anyone going through ex parte renewal is not passively terminated without first receiving a request for information or renewal packet to confirm all data being used by DMS to determine eligibility is up to date and accurate. Any thoughts about that before we vote? Then I'll ask for a motion.
So you said, just making sure I'm getting it down right, that to make sure that they're not passively renewed without first receiving, did you describe it as a
No,
request
not
for
passively
information?
terminated. Here, I'll put it in I wrote it
Thank
down.
you.
Yeah. Here it is. That DMS ensure that anyone going through ex parte renewal, which means passive, is not passively terminated without first receiving a request for information or renewal packet to confirm that all data being used by DMS to determine their eligibility is up to date and accurate. So we know that people can be passively renewed without any action, and that's great, but you shouldn't be passively terminated without any action. So that's where really what I'm trying to get at.
Thank you. I make a motion to recommend.
Thank you. Can I get a second?
Second,
Thank you,
And-
Melanie.
and Emily, and this might be just a snafu that, but there has been historically issues when an individual transitions at age 18. And this is like SSI, but it impacts Medicaid as well. But I don't know if there needs to be language within the recommendation that they, because that's happened to quite a few individuals where they are this whole passive, they were evaluated, or they got correspondence through via mail, and then they were dropped because of the end of when they were a child under SSI and moved to being adult at age 18, and they weren't notified. But it impacts their ability to maintain Medicaid. I'm probably not saying that very well, so I apologize, but I
No,
don't know.
no, I have a vague idea of what you're talking about, Melanie. I think
I'm
what
sorry.
would be helpful is if we could discuss this on the next call with,
Okay. Okay.
with Deputy
Yes.
Commissioner Cecil and
Okay.
perhaps with some of her staff as well.
Okay.
To
Sorry
just
to
make
bring
sure
it
that
up.
we understand the issue clearly. And if you want to work on a recommendation between now and February, based on your experience with this, I think that would be really helpful. Would you be comfortable with us making this recommendation that's more broad and not specific to a particular age group? And then we can have another recommendation?
Yes, yes,
Okay.
yes.
All right, thanks. So did you say that you seconded the recommendation already? Okay. All in favor, say aye. Any opposed? Okay, the motion carries. Thank you all. Any other recommendations? And Melanie, if you have one now, of course, we don't have to wait. I didn't, but if you want to discuss it further, we can do that too.
No, I'm happy to wait until February. It's happened more frequently than I'm surprised at how often that it happens. And I'm worried about the individuals that it impacts.
Would you mind between now and the next meeting also just sending us as the TAC members and
Yes.
including Aaron in that, some additional information?
Sure.
That would be really helpful.
Okay.
And if we don't have any other recommendations, the next item is MAC meeting representation. I'll plan to be at the next MAC meeting and to report for the TAC. And then the final item here is our 2024 meeting schedule. And we are proposing to essentially stay on the same schedule, which would be meeting at 1:30 p.m. Eastern Time on February 20th, April 16th, June 18th, August 20th, October 15th, and December 17th. And of course, if we end up having a conflict with one of those dates, we can always reschedule. The sooner the better. But is this a calendar that we can approve? All right, I'll take a motion to approve our 2024 meeting schedule. Thank you, Arthur. And a second?
Second.
All right, thanks, Melanie. All in favor, say aye. Aye.
Aye.
Okay, great. We have a meeting scheduled for 2024. It is hard to believe that year is almost here. Before we adjourn, I just want to wish everyone happy holidays. I hope you get to rest and relax a bit before 2024 takes us all by storm.
And I wanted to compliment Kentucky Voices for Health on their conference too. That was excellent. I'd never been before, but I was really very much impressed with the conference as a whole. Thank you for doing that.
I'm so glad you could come. And yeah, I was happy with it too. I will say it was a lot of work, so happy for it to be done. But I enjoyed it, and I thought we had some great speakers. So, and a packed room of people. So thank you all, everyone who came. I know there are a number of people on this call who were there, so thanks for joining us.
And can I say one last thing and then I'll be quiet?
Of course.
I wanted to compliment Arthur Campbell because they just did a webinar on state leaders in advocacy, and he is a force to be reckoned with. So it's so wonderful to be on this TAC with him because what they talked about and he talked about was excellent, and just really and I'm hoping I can get a copy of the recording of it so that I can share with you all because Arthur has been instrumental in our state when it comes to individuals with different kinds of disabilities, and he has done climbed the Capitol steps and been arrested, you name it. He has just done phenomenal things, and so we have a real true hero on this TAC, and so but I just want to compliment him.
He only have been. Oh, have. You only. Has been.
No.
He's old.
You're too modest, Arthur. We really do. We are honored to have you as part of our TAC and appreciate your input so very much.
He said, but thank you. If anyone wants to have a if anyone wants to have a copy of what he wrote, email him and he will send it to you.
You're welcome to go ahead and send it to the TAC and Aaron and Kelly and make sure that we have it, just on record.
Okay.
Yeah.
Say, okay, boss.
I appreciate how much preparation you put into these meetings as well, Arthur, and thought. So I think we have accomplished our agenda today. Thank you, everyone. And like I said, happy holidays. I don't remember, I never do, if we need a motion to adjourn, but let's just adjourn by acclamation. A motion? All right,
Second.
I'll go ahead and take a second. We're going to vote on this then.
Second.
All right, and all in favor say aye.
Hi.
Any opposed? All right, we are adjourned. Thank you all.
Thank you.
Hi.
I'll see some of you on the nursing TAC in a minute.